Welcome back. When you or a loved one is critically sick, having a healthcare team come into your home to provide care sounds like a great option. But how do you know you're getting the best possible care from people you can trust? Roxanne Closey is still with us. Hi, Roxanne.
Hi.
So the word home can mean a lot of different things to different people: apartment, a nursing home, an assisted living facility. Can all of these home healthcare services go into all these situations?
So it really does depend upon the level of care that that individual requires. Well, let's just work backwards. So from a hospice standpoint, we can basically take care of anyone in their home or whatever their home is considered. So if it's a nursing home, if it's an assisted living facility, or even their own bricks and mortar house. So we can provide hospice services there. When it gets to home health care and those skilled nurses and therapists, those resources are available in a nursing home or a skilled nursing facility, but not necessarily available in an assisted living facility. So our nurses will go into assisted living facilities in the home health care arena, but not into a skilled nursing facility or nursing home. When it comes to personal care, they're able to assist in an assisted living facility or in their home or apartment, but not in a nursing home. So it's kind of, you have to identify what the needs are and where that person is, and then apply the appropriate resource.
Can you talk about the oversight on providers of personal care, home health, and hospice? How do we know they're being run well and caring for the people the way they should be caring for them?
So because we are reimbursed by Medicare and Medicaid, we have to be held to the standard that they hold us. We have recently had our hospice survey in Butte. It actually happened the day after Christmas. They showed up and they come unannounced.
Okay.
They were on site for 3 days and found 0 deficiencies. That's something that is not heard often. Our home health agency just had its survey the month of March, and we had a spectacular survey according to the surveyors from the state. Our personal care program just had its survey this month, and actually in April, and we had a spectacular survey. So when we can look at our outcomes and having the state individuals come who see programs across the state, it's not just, they don't just come to ours, but they go to all of them in the state. And for them to say that we're doing an outstanding job or have a spectacular survey speaks volumes. I'm very proud of my teams.
Absolutely. So knowing that everyone has to pass surveys, how does someone choose then a personal care, home health, or hospice program? Can they use that information?
So with personal care, it's basically giving the different agencies a phone call, and then would pursue the one that you feel the most confident with. I'm not certain that you would be able to get someone from the state to say this one is better than this one. Basically, people have choice. With home health, you can go online and hospice as well and look at the compare data, and you can choose one that has good outcomes. I can tell you with our home health agency at this point, we are either meeting or exceeding the national benchmarks in 14 of 15 measures. So we have really done a lot to improve our quality, and our hospice measures that we have to report, we're at 100% for all of those.
That's excellent. So if someone is using one of those websites, can you give any guidance? Are they just looking at outcomes? What exactly are you looking for on those sites?
They're looking, what you would be looking for is the results of surveys that the patients or the families have filled out and then returned. So that's basically their experience, what you're hearing or what you're seeing.
Okay. So let's imagine I need home health services and I've used Home Health Compare to identify an agency that I'm interested in. What do I do next?
So look at the star rating, and Medallion Home Health in Great Falls is a 4-star out of 5 stars. So we're almost at the best rating. So that's what you would want to look at.
Excellent. So we've heard stories about people whose doctors refer them to maybe just one home health or hospice provider without necessarily encouraging them to go through that decision-making process. And is that okay?
So one of the rules, so to speak, is that we as providers, and even if we have someone on our home health service and they are referred to hospice, there's a choice. So you have a choice. If you are familiar with one hospice or another, then you can choose the one that you would like to go to. We have to give that choice as providers. So being able to just give a generic list with the different facilities that have the certain services that they're looking for is imperative. It's very important.
So what if you make a decision and you change your mind and you decide you want to go with someone else? Is that okay for folks to do?
Absolutely. If there's a reason that you want to choose another provider, then you have that right, and we will support it, regardless of us feeling bad, or obviously we don't want anyone to be unhappy. We want to make sure that we're providing the very best care possible. But sometimes personalities don't mesh, and so we support that decision.
What if someone wants to stop using services altogether?
We support that too, because it's always patient choice. Always patient choice.
What are your feelings about working in the field of healthcare provided at home? You're passionate about this, obviously.
I have the best job in the whole world. I get to be able to help my people, my managers, my PCAs, my nurses, therapists, social workers, everybody have the resources that they need in order to provide exceptional care. And I have absolutely outstanding clinicians that are going into the home and taking exceptional care of our patients.
Thank you. Thank you so much.
Thank you.
That's all the time that we have today, but thanks so much. I want to thank Roxanne for being here. We want you to stay fit, stay well, and stay healthy for life, and please join us next week. Take care.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.